Dear fellow humans in worldwide co-quarantine, this is part of a series of short videos from the global Economy for the Common Good movement, which wants to share key thoughts and learning points from the COVID-19 crisis. Our movement is working towards system change and develops alternatives for the huge social and ecological challenges that humankind has been facing already before the outbreak of the corona crisis. Lesson 3 is resilience, crisis resilience or survival in a crisis. The key question here is why aren't countries more resilient to enable us to cope better with this crisis? Most countries have had to impose severe restrictions on free movement of populations to manage the disease and prevent failings of entire health services. There are shortages of medicines and equipment, with countries competing for scarce worldwide resources. The problem here is that a globalized economy, with its focus on competition and who can manufacture the cheapest, has failed many national health services. For example, only 4 companies worldwide manufacture penicillin, a basic ingredient in medicine. 3 of these companies are in China, a glaring example of the limitless vulnerability of our global supply chain that exploits the labour economy. Resilience would be strengthened if this basic ingredient and others that will likely be necessary to tackle the current crisis were manufactured in all regions, decentralized, if necessary in university laboratories, so that it can be made available everywhere, promptly and safely, even if a natural disaster takes place, a regime change or a new illness like COVID-19 breaks out. What applies to penicillin also applies to countless other products and components in global value chains. Both the excessive global division of labour and the just-in-time primacy, both results of capitalist understanding of efficiency, have radically weakened the resilience of the global economy. As has long been demanded by many, the solution should lie in the greater regionalization of economic cycles. Not everything has to be produced locally and homemade, but priority should always be given to proximity. We call this economic subsidiarity, the principle of making decisions as locally as possible. Another example of weakened resilience is agriculture. The harvest is approaching and it is mainly carried out by poorly paid workers from Eastern Europe and North Africa. And the same restrictions on movement that have been carried out around the world for COVID-19 are now preventing the cross-border flows of seasonal workers to harvest fresh fruit and vegetables. So who will harvest our crops? A more resilient agriculture would hire local workers for local production with decent conditions and wages. A solution to the crisis would therefore be to upgrade the primary sector and give more people work there. The alternative is likely to be empty supermarket shelves and crops left to rot in the fields. Another example is the care of the elderly. Instead of valuing care work and paying adequate wages, employing people from the local community, these posts are often filled by a cheaper migrant workforce who have to leave behind their own children and families. Now, in times of crisis, they cannot travel, and this vulnerable group of older people in need of care are left alone. Many of them have to be brought to hospitals where they can get infected with the coronavirus, leading in some cases to dire consequences. So the third learning from the corona crisis is we can increase resilience through adopting greater economic subsidiarity, which means giving consideration to local and regional supply, rather than simply relying on the cheapest products and services, which may turn out to be too little and too late.